Thank you. I want to thank all of you for being here. I think like my colleague, Senator Heitkamp, we both were attorneys general in our state before we came here to the Senate. And one of the things that I had worked on as an AG was reentry programs. And I'm a strong supporter of the Second Chance Act and supporting its reauthorization, but saw it from an attorney general context where even people who were incarcerated for serious crimes, that we did not give them any path for success going forward because they came out. If they had a substance abuse problem, it was the underlying issue was never dealt with. If there was mental health factors, that was not dealt with. No job, no place to live. If you put yourself in those shoes and you're that person and you're put out on the street, then I dare say that all of us around this dais probably wouldn't be able to put it back together. So I wanted to get your thoughts. Dr. Dillard, I saw that your focus is really, as I understand what you're working on, it would be some form of reentry program. And we saw it in our state get some momentum and then sort of fizzle, and wanted to get your thoughts on reentry type programs and what more we could do to make them more effective, to try to end this cycle and to get people on to productive lives. And then I had some other follow-up questions, but appreciate it.
Well, I think reentry is a crucial point. If there's planning done and individuals are giving different options. I know the federal system, 6 months in a halfway house is something that I went through that was very beneficial for me. I just wasn't released to the streets. And I was able to obtain employment during that period and save some money to be able to rent a room at least when I was done with my federal time. What I'm seeing today, though, is young men coming out of our state and county systems homeless, 17, 18 years old, who can't go live with their mother because they've been told you can't go there because of subsidies connected to their housing, and they're couch surfing. And oftentimes when they're couch surfing, it's probably with those who aren't doing so well or the antisocials that had an influence in them being placed in the criminal justice system in the very first place. Housing initiatives are huge. I don't have the solutions. I can say that we're working on them in the region that I'm working in. Nonprofits and faith-based organizations are engaging with us in providing housing at an affordable rate. Preparation is huge. Individuals have to identify certain things while in custody in order to have a paradigm shift that this can't be an option. This can't be an option. I had a client to tell me that, committing a new crime wasn't his first option, wasn't his first choice, but it was his very last option. And I know the troubling times that he was in, sleeping on park benches, couldn't go to the shelter for various reasons, and he committed a new crime. As he told me, it wasn't his first choice, it was his very last option. And so the reentry process, along with all the barriers, I think mentoring from formerly incarcerated or connections with organizations that hire formerly incarcerated, because we're ambassadors. I look at us as being those who can help them through those trying times and pivot points in reentry.
Senator, may I respond to that question very quickly?
Sure.
This is an oversight hearing on the Bureau of Prisons, and the independent review that I keep referencing to, and I'm happy to submit my annotated copy, we'll have a lot of highlighting, actually looked at this question of the Bureau of Prisons practices on reentry programming, and here's its finding in one sentence. There is no formal Bureau-wide reentry preparedness program specific to restrictive housing and inmates in these settings, inmates in these settings have very limited access to reentry programming. the Bureau does not do a good job in reentry programming. About 2,000 people a year in the Federal Bureau of Prison go from solitary back to community. One of the things the study found is that many of them, they don't know the exact number because the Bureau doesn't track it, are sent directly from solitary back to communities. That is a terrible practice that needs to stop immediately. There needs to be a focus on reentry programming in the Federal Bureau of Prisons.
Thank you. Ms. Kerman, I wanted to ask you, one of the things that we're seeing, and I saw this when I was AG as well, but we're seeing just on a devastating scale in our state right now is opioid and heroin addiction. And I've been working on legislation called the Comprehensive Addiction and Recovery Act. I'm hoping that we're going to take this issue up here to not only the, I hope the Second Chance Act, but also this Comprehensive Addiction and Recovery Act. There was some discussion you had about this idea of alternative courts up front. What would you do as you think about this issue? How many people did you encounter that had addiction issues that were underlying why they were in prison? And how do you see, this to me, to Senator Heitkamp's point, I fully agree. We can't arrest our way out of this. This is a public health crisis. But I wanted to get your thoughts on what you think we should be focusing on most.
Thank you, Senator. What's happening in New Hampshire is also happening in Ohio and, all over this country in terms of huge spikes in deaths from heroin and other
Devastating.
opiates.
I mean, you wouldn't believe the parents that are coming to me. It's just heartbreaking.
Yeah, it is. It's devastating. It is fundamentally a public health question first and foremost, and so its intersections with the criminal justice system really should be secondary, particularly as we continue to see crime rates very low, violent crime rates very low. And so while obviously people who sell or use drugs are breaking the law, remembering that intervening in that addiction cycle is the single most important thing and can't be accomplished with a prison or a jail cell is completely central. We see a lot of folks in the States trying lots of different things, and I'm obviously neither a doctor nor an expert in addiction, but we see safe harbors in places like, I believe, Gloucester, Massachusetts, and some other parts of the New England states have really tried very innovative approaches to getting folks the medical help they need and having that be the primary concern rather than incarceration. When we look at states like New York, New Jersey, California, the states that have reduced their prison populations the most and also have simultaneously continued to enjoy huge declines in violent crime, one of the things that we've seen in those states, and I know Udi could weigh in on New Jersey, is a huge decline in prosecutions and incarceration of people for low-level drug offenses, and a recognition that that public disorder is a reflection of a health problem, and that's the way to tackle it.
Thank you.
Thanks, Senator.